Once you've completed your dental prophy, the good next step is going to be doing some oral exam, charting. One big instrument you're going to use is this periodontal probe, and it's measured in different millimeters, the different sections are. The other thing that's going to be really important is an explorer, which is a very fine, sharp-tipped instrument that finds little fine lesions. So when we're using our periodontal probe, you want to go all the way around the tooth. You want to see if there's any pockets that your probe may fall into. And if you have any pockets, you want to measure in millimeters and record what that is. Also, if there's any areas of gingival recession where we have root exposure, you want to measure that and make a note on your dental chart. In this patient, we have an oral nasal fistula. So we have a hole that is communicating between the mouth and the nasal sinus. So we definitely want to measure the size of that oral nasal fistula with using our probe, and that might help us gauge on the best way to repair that oral nasal fistula. Also, if we notice there's little dissolvable sutures left from a previous repair, so just make a note of that on your dental chart just so you're very thorough. So again, we're going to go around each and every tooth with our periodontal probe, looking for any types of pockets. Don't forget to record if you have abrasions on the teeth, any abnormalities at all. Once we're happy with the probing and any pockets, we're then going to take our explorer, and you want to hold it at 90 degrees to the tooth along the neck of the tooth to gently feel for any types of roughness on the tooth itself. If you feel anything that seems rough, you want to go back and evaluate with your air water syringe and look down in there to see, was there a piece of calculus left behind? Is there an enamel defect? This is also a really good tool and essential in finding tooth resorptive lesions in dogs and cats. When you're doing your oral exam, just do it in the same order every time as far as the quadrants go. That way you do everything in the same manner each time, and you are probably going to be less likely to overlook something. Also, while you are doing your intraoral exam and your charting, obviously we want to focus on the teeth, but also don't forget the other tissues in the mouth. So make sure you do a really good exam on the buccal mucosa, the palatal mucosa. If you feel any bumps or any abnormalities in the palate, if any area looks darker or lighter than it should, it's never wrong to biopsy. So just make sure you do a really thorough oral exam. Also with the tongue, we want to look underneath it really well, along the dorsal aspect also.